Okay, I'm Alexis Sykes. We'll be doing a basic IV insertion ordered by the doctor, and I assess the proper lab values and the patient's known allergies. And the doctor ordered a 20 gauge needle for blood transfusions or medication or any future procedures. And I am going to do my hand hygiene, and I'm going to apply my gloves. And while I get these gloves on, I am going to prime my INT extension with the pre-filled syringe of 3 milliliters. It's already clamped, so I'm going to unclamp it. Okay, it is primed, and I'm going to clamp it closed. And then I identify the patient with his 2 patient identifiers, and I'm going to ask the patient what arm do they write with, and use the non-dominant arm in the most distal area, and make sure it's no pain amongst palpation, and I will make sure it's not an arm on a mastectomy or a shunt or fistula, and it doesn't affect any ADLs. And so I'm going to check the radial pulse, and the pulse is present, and I'm going to apply the tourniquet, which is 4 to 6 inches above the insertion site. Okay. I selected my vein, and I'm going to clean in an outward circular motion.
On your water. Okay, but that's not what I see right here. Okay.
And I am going to make sure my 20 gauge needle is beveled up and at a 15-degree angle, and I'm going to pull the skin in the opposite direction of the venipuncture. And I'm going to tell the patient you're going to feel a quick stick, and I'm going to insert the catheter. Okay, and I'm inserted like a 1/4 of an inch, and then once I see flashback, I am going to advance the catheter and loosen the stylet. And I'm going to apply pressure 1 inch above the insertion site, and I'm going to release the tourniquet. And I'm going to apply the INT extension. And I am going to flush 3 mL of normal saline using the push-stop method. Push, stop, push, stop, push, stop. And I'm going to apply positive pressure by flushing and clamping at the same time. And I'm going to apply the tegaderm. And I would label the tegaderm with the date and the gauge of the needle and the my initials and the time. And I will remove this, and I will tape the tube like this so it won't get caught on anything and still able to be used. And I will make sure the insertion site is still visible, and I would put all of my needles in the sharps container, and I would wash my hands and take off my gloves, and then I would document what I did. I would document the date, the time, the gauge of the needle, the insertion site, the the number of attempts it took to get the catheter in, the any teachings that were given to the patient, and how the patient reacted to the insertion.